is National Mental Health Awareness Month, and joining me today is Myrna Daniels, who's the Executive Director of the Crisis Center. So Myrna, thank you so much for being here today. So first, just talk to us, of course, since it is Mental Health Awareness Month, just the importance of mental health and the fact that it really can impact everyone.
Yes, it really does impact us, mental illness, either directly or indirectly. It doesn't discriminate against our background, so it is really important to acknowledge and recognize that any of us can be impacted.
And I know we think a lot about our physical health. You know, we think I gotta eat healthier or I need to get out and exercise a little bit, but the mental health is maybe something that we also forget needs tending to as well. It's just as important.
Of course, just like we would seek support or treatment for diabetes or hypertension, it's just as important to seek treatment for any mental health condition.
And people that maybe have a mental health condition and don't know about it or just don't go in and, get some help for it, just talk a little bit about kind of the ripple effects or the harmful effects that can have.
Yeah, so untreated mental health conditions can really produce negative outcomes. That can include social isolation, even further physical conditions, and just really a poor quality of life.
And just like with physical health, the earlier you address it, the more successful the outcome, the better your options down the line.
Absolutely. Early intervention is key. It's really important to seek that treatment as soon as possible.
And I think one big thing with mental health is there's a stigma with mental health, that it's not okay to have that issue. It's almost maybe shameful to have to go in and get help about that. But that is not how people should feel, right? It's something that affects anyone.
Absolutely. We really need to normalize the conversations around mental health, and it's okay to seek treatment. It really is a sign of strength instead of a weakness.
And what are some ways that we could kind of help with that for people who are struggling?
I think one of the best things that we can do is to really take it upon ourselves to be educated about mental health conditions and even the resources in our communities, because when we have that information, we are equipped to provide that to someone that's struggling.
And what are some of those community resources for people?
So we have a number of providers here in our communities, including prescribers, therapists, community-based programs, and peer supports. And then we're fortunate enough to have the Southeast Idaho Behavioral Crisis Center in our community that is available to anyone struggling at any time. We're open 24 hours a day, and there is no cost to anyone coming in.
Okay, and if they want some more information specifically on the Crisis Center, where can they go to get that?
Yes, you can call 208-909-5177, and we're located on 7th Street in Pocatello.
Okay, excellent. Myrna, thank you so much for being here today. We really appreciate it.